During this film, we will explain to you what anesthesia is. The anaesthetists are specialist doctors who administer anesthesia. This can be a general anesthetic, regional anesthetic, or sedation. During surgery, the anaesthetist or a specially trained nurse will be looking after you during surgery or procedure. They are also responsible for managing and treating changes in your critical life functions, such as breathing, heart rate, and blood pressure, as they are affected by the surgery being performed. Furthermore, they diagnose and treat any medical problems that might arise during and immediately after surgery. Before surgery, you will visit the pre-assessment clinic. Here, the anaesthetist or specialist nurse will evaluate your medical condition and formulate an anesthetic plan to make sure that you get through surgery safely. Before visiting the clinic, you will be asked to fill in a questionnaire. It is possible to do this at home via Patiëntenportaal Mijn UMC Utrecht. This questionnaire will be used to assess your health during your visit. It is vital that the anaesthetist knows as much about your medical history, lifestyle, and medicines. Also, while visiting the clinic, your physical condition will be taken into account by listening to your heart and lungs, and maybe a blood sample will be taken, or an electrocardiogram will be made to check that there are no problems with your heart. If it is necessary, you'll be asked to visit a pulmonologist or the cardiologist. Which type of anesthesia is the best for you will be discussed beforehand at the clinic. This depends on what you wish yourself, what type of surgery or procedure takes place, and on your health. In certain cases, various forms of anesthesia are safer than others. What is important before you receive anesthesia or sedation? You must be fasted beforehand. If you're not fasted, then there is a chance that fluids or food can come into your lungs. This is for every type of anesthesia or sedation. You can eat up to 6 hours before the procedure. After that, you can only drink clear fluids till 2 hours beforehand. Clear fluids is water, lemonade, and or tea without milk. We advise you to drink beforehand because this can enable you to recover quickly after anesthesia. If you're on medication, this will be discussed during your visit at the clinic if it is to be continued or stopped. Please follow this advice, as this is important for your safety during and after the operation. If you are sick before your surgery or procedure, please inform us, because this can interfere with anesthesia. If you are very sick, we will have to postpone surgery. After anesthesia, you go to the recovery room. Here you are looked after by nurses who are specialized in post-anesthesia care. Here you are monitored on your heart rate, blood pressure, and oxygen levels. Also, they make sure that you are comfortable, that the pain is acceptable, and you are not nauseous. If this is the case, ask the nurse for some extra medication. The medication is given orally or via the IV drip. If everything is satisfactory, then you go back to the ward, or you can go home. This depends on the procedure. If the procedure is in day care, then you can go home the same day. Please make sure that you are not alone and that there is somebody to drive you home. This also applies to the first night after your procedure, that there is somebody to help you in case of an emergency. You can read more about the anesthesia on our website or the folder which you have received.